As Senate Republicans push back a vote on health care until at least mid-July, President Trump said Wednesday he still has confidence it will get done.
Just to do a little official business, health care is working along very well. We could have a big surprise with a great health care package. So now they're happy.
What do you mean by big surprise, sir?
I think you're going to have a great surprise. It's going to be great.
CBS News chief congressional correspondent Nancy Cortez is in Washington. Nancy, Senate Majority Leader Mitch McConnell, we're hearing, is planning to send a revised health care bill to the CBO to be scored Friday. Is this realistic, Nancy? And do you think he can get more GOP senators on board in such a short time frame?
It's not clear that he can, Rena, but nevertheless, Senate leadership has to put this artificial deadline in place to get all of their senators focused on this issue and to try to force them to commit to something. If you leave it open-ended, everybody goes off for the July 4th recess. They get all kinds of mixed messages from their constituents, from outside groups, from officials in their own states, and that only makes things harder for Republican leaders. So there is this sense that it's now or never. And they know the universe of issues that they're dealing with here. They know the options that are on the table, the fixes that senators, both conservative and moderate, would like to see. And so if they can't come up with a compromise now that can appeal to everyone, there's no sense here that it's going to be any easier 2 weeks or 3 weeks down the line.
Nancy, the Republicans that you're talking to, what are the key issues that they say they have with the current bill that they want addressed?
It's all over the map, and that is part of the challenge for Republican leaders. First of all, you've got moderate Republicans who say primarily that the cuts to Medicaid are too deep. It's going to leave too many people in the lurch, the most vulnerable populations in their states. And they say even if their own states try to close the gap, they just financially don't have the means to do that. So that's number one. They want to see smaller cuts to Medicaid. Number two, you've got some moderates like Lisa Murkowski and Susan Collins who don't like that this bill has cut funding for Planned Parenthood. They'd like to see that reinstated. On the other end of the spectrum, there are conservatives who feel that the bill leaves too much of Obamacare in place, particularly Obamacare's regulations. For example, requiring that insurance companies include a set package of services when you sign up for coverage from those companies. They want more plans that are at a lower price point. Maybe they're bargain basement plans. Maybe they don't include everything. But those lawmakers say it's up to the individual. The individual should have more choices, whether they want full coverage, they want access to everything, or they want a more bare bones plan.
That's a lot to address, Nancy. You've covered these town hall meetings back in the at the homes of these senators and congressmen. What do you say when they go back home for 4th of July research? They meet with their constituents. Are they concerned about the political repercussions if they don't follow through with repealing Obamacare?
You know, they are facing political repercussions no matter what they do. If they don't repeal Obamacare, certainly there are a lot of Republican constituents in their states, particularly for senators who come from red states, who are going to be disappointed. Although, if you look at the polling right now, Obamacare does fare better than this Republican replacement plan. So the messages that they're getting from their constituents are very mixed. And of course, liberals and progressive voters are energized, they're mobilized right now, and they are agitating for Republican senators to essentially rip up this GOP health care plan and to sit down with Democrats. And you have some moderate Republicans like Susan Collins, like John McCain, saying we have felt all along that we should sit down with Democrats and come up with a more middle-of-the-road plan. But most of their Republican colleagues are not there right now, Rena. They still believe that a GOP plan that reflects conservative principles is going to look a lot better. It's going to look a lot more like what they promised to their constituents.
And is it just too much for folks to ask for Democrats to come on board and work with Republicans to get something passed through? Any sight of that possibility happening in the next month or two?
Well, Mitch McConnell has said point blank that if he can't get the 50 votes that he needs within his own party, if he can't come up with something that they can all agree to, then he's going to have no choice but to sit down with Chuck Schumer and negotiate, because Democrats and Republicans alike acknowledge that there are problems with the individual marketplace, that choices are going away, that many counties are facing one choice or no choices at all on the individual market, and that premiums are going up, and that policies do need to be fixed. And Democrats say, hey, we're ready to compromise. We're ready to talk to you. We feel that Obamacare does need to undergo some changes. However, Democrats say they're not willing to sit down and talk if the premise is that Obamacare is going to be repealed, if the premise is that there are going to be $800 billion worth of cuts to Medicaid, or if the premise is that there are going to be big tax cuts for the wealthy. And so that's the real challenge going forward if they do sit down, because right now those are three of the main underpinnings of this Republican plan.
Nancy Cordes, Chief Congressional Correspondent. Thanks for joining us, Nancy.
You're welcome, Rita.